It's Dua here.
In Leap, I've discovered Flowers and Flames, the new floral facet, the YSL way. It's floral, but in the hottest way, and it's both luminous. It's really such a statement. It's a real ultimate freedom sensation. So, Yves Saint Laurent.
Welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm your host and public health scientist, Dr. Jess Steyer, and today we are going to talk about something called cold urticaria. The clock is ticking, so let's get to it. All right. Now, this topic is near and dear to my heart because my son has cold urticaria. And it's something that my husband, who's an ER physician, and I have done tons of research on. I've looked into it. And I will say that he has proofed the content for today's episode. So you have that clinician sign off on this topic. So let's dig in. So what exactly is cold urticaria and how does it affect kids? So cold urticaria is a type of physical urticaria, or hives, that's triggered by exposure to cold temperatures. Now, obviously, the temperature is dropping now. You know, we're in the fall. We're coming up on winter pretty quickly. I live in New England, so the temperature definitely drops and gets, significantly cold out there. And I see this. I see that my son develops hives in the cold. So in children with this condition, skin that's exposed to cold air, water, or objects can develop red, itchy welts or hives. Now, these reactions typically appear within minutes of cold exposure and can last for about 1 to 2 hours. It's important to note that the severity can vary from mild, localized reactions to more severe systemic reactions in some cases. So what are the signs and symptoms that parents should look out for? Parents should be alert for the following symptoms: red, itchy welts or hives on areas exposed to cold, swelling of hands when holding cold objects, swelling of lips or tongue when consuming cold foods or drinks, and in severe cases, difficulty breathing, dizziness, or fainting after cold exposure. Now remember, these symptoms typically appear within minutes of cold exposure and can be mistaken for other allergic reactions. So how is cold urticaria diagnosed? If you suspect that your child has this condition, a pediatrician or allergist can perform a simple test called the ice cube test. They'll place an ice cube on your child's skin for a few minutes and then observe the area for the development of hives. Blood tests might also be conducted to rule out underlying conditions. It's crucial to seek professional medical advice for a proper diagnosis, as the symptoms can sometimes be confused with other conditions. What treatments are available for kids with cold urticaria? So, treatment in kids typically involves antihistamines to reduce itching and prevent hives. In very severe cases, epinephrine autoinjectors can be used for emergency use. And some recommend gradual cold exposure therapy, which must be done under medical supervision, and the goal is to build tolerance. The primary approach, however, is avoiding triggers and managing symptoms. Your child's doctor will create a personalized treatment plan based on the severity of the condition. So, how can parents help their child manage cold urticaria in daily life? You can ensure that the child dresses warmly in cold weather. This is a big one for us. So when our son refuses to put on gloves or a hat, for example, we remind him about, what will happen. And this definitely helps convince him to wear those warm weather clothes in the cold weather. You want to avoid sudden temperature changes whenever possible. Teach your child to recognize symptoms and communicate them. So, for example, they should know when to inform teachers or caregivers about the condition. You might want to carry antihistamines or prescribe medications at all times. And for severe cases, you might consider a medical alert bracelet. Again, this is a conversation that you absolutely should have with your child's pediatrician. Most kids with cold urticaria can participate in normal activities. This is typically not a severe condition, but again, you definitely want to get specific advice tailored to your child's needs. All right, well, I hope you learned something today, and we have lots more to share. You can get your daily bite of health every day, Monday through Friday. If you like what you've heard here, please let us know. Leave us a review and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
When you sign up at Work Money, you could win $50,000. With the average renter paying around $2,100 per month, that means you can have rent covered for a whole year and more. So you can be more. And when you're more, that means you get more. And more. Ooh, but not so much of that. Sign up at Work Money. Get money-saving tips. Skip the rent. Get more rich. Sign up at workmoney.org/more-rich contest for your chance to win $50,000.